So the purpose of our study was to determine and compare the association of type 1 diabetes and type 2 diabetes with sudden cardiac arrest. We also wanted to compare the sudden cardiac arrest resuscitation profile between individuals with type 1 diabetes or type 2 diabetes or no diabetes. So my name is Faye Norby, and I'm a research scientist and assistant professor at Cedars-Sinai Medical Center. I'm the first author of the publication Sudden Cardiac Death in Type 1 and Type 2 Diabetes, and this paper will be appearing in an upcoming issue of Mayo Clinic Proceedings. So to talk about the study design, we performed a case control study. We obtained sudden cardiac arrest cases from Oregon SUD study, which captures data from Multnomah County in Oregon. We used the data from the years 2002 to 2019, and we included those age 18 and older in this particular study. So what we did is we captured all of the out-of-hospital cardiac arrests from EMS, medical examiners, and area emergency rooms. And then we adjudicated our sudden cardiac arrest cases. So during those years, we found 2,771 sudden cardiac arrest events that we included in this analysis. We obtained control patients without sudden cardiac arrest or prior cardiac arrest from Kaiser Northwest, which encompasses a similar region as our cases in Oregon. We matched our cases. Each case was matched to 3 controls based on age, sex, and race ethnicity. And we captured diabetes status from medical records that uses standard definitions for type 1 and type 2 diabetes. From there, we use logistic regression models to evaluate independent associations between diabetes and sudden cardiac arrest, and to also look at the resuscitation profile in each of the sudden cardiac arrest cases. So after matching, we matched 2,771 cases to over 8,000 controls. Everyone had a mean age of 65 years of age, and they were 33% female and 24% non-white race. In total, 37% of our sudden cardiac arrest cases and 24% of our controls had diabetes. In those with diabetes, the proportion of type 1 was 6% among our cases and 2% among our controls. And in general, our sudden cardiac arrest cases had worse cardiovascular risk factors compared to our controls. Within the diabetic population, under the fully adjusted model, the odds of having sudden cardiac arrest were 2.4 times higher in those with type 1 diabetes compared to those with type 2 diabetes. This is the first time we've seen this higher association of sudden cardiac arrest in those with type 1 diabetes. When we looked at the resuscitation profile of our sudden cardiac arrest cases, those with type 1 diabetes were more likely to have an unwitnessed arrest and less likely to receive resuscitation and less likely to survive compared to those with type 2 diabetes and to those without diabetes. So therefore, type 1 diabetes was more strongly associated with worse outcomes following resuscitation. So what does this mean for patients? Our findings suggest that the higher sudden cardiac arrest risk in type 1 versus type 2 diabetes is not entirely explained by differences in clinical profile. This is important for prevention of sudden cardiac arrest and may also have implications for risk stratification when we look at preventing sudden cardiac arrest in those with diabetes. We need larger studies in diverse regions to confirm our findings and further investigate the mechanisms with which all types of diabetes and also type 1 diabetes confer that higher risk of sudden cardiac arrest. Future studies may also want to compare the effectiveness of primary prevention implantable cardioverter defibrillators in those with type 1 and type 2 diabetes, especially those identified to be at higher risk, such as females with type 1 diabetes. In summary, we found that within the diabetic population, those with type 1 diabetes have a stronger association with sudden cardiac arrest compared to those with type 2 diabetes and to those without diabetes. And we also found diabetes reduces the chance of survival from sudden cardiac arrest. And individuals with type 1 diabetes have worse outcomes than those with type 2 diabetes. So these findings have implications for sudden death risk stratification in diabetics. And we invite you to read this article in Mayo Clinic Proceedings, which will be available soon.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.